Wache, and welcome. This is Anne from the Sioux Lookout Practice Consultant Team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. Hi everyone. Today I have Liz Wallace with me, nurse practice consultant and nurse practitioner. Been in the North for 7 years now. So, hi Liz, what would you like to talk about today?
Today I want to talk about medical directives.
All right. I feel like we've been down this road before.
We have. We released an initial batch of medical directives in the Sioux Lookout region back in 2020. And that covered an array of mild episodic presentations. Think scabies, impetigo, vulvovaginitis, and they accompanied the clinical care pathways. But after a lot of discussion with the Sioux Lookout physician group, they made the decision to rescind the Sioux Lookout region set back in 2022. However, Moose Factory still has their primary care medical directives, which is a good thing.
All right. Just to take a little step back on that, what sparked the creation of medical directives in the beginning anyways?
So after the Auditor General's findings in 2015, there was a push from both ISC National and the individual provincial College of Nurses to have nurses working within their regulated scope of practice. So for us in Ontario, this means no diagnosing and no prescribing. And we see this reflected in all of the clinical practice guidelines and clinical care pathways published since. Now we're at a point where it is consult for all episodic clients in the Ontario region.
So if we're consulting for all episodic client presentations, why are we talking about this again?
Well, we've been working hard with the physician group over the last year to update the old prenatal medical directive and also create a brand new laboratory testing one. And finally, they are signed and ready for release.
This is excellent news. So just to touch on a few points, let's just start with the prenatal medical directive. Just tell me a little bit more.
For sure. So we've renamed it the perinatal medical directive because we wanted to make sure that it's encompassing of care for clients before, during, and after pregnancy. It is still very similar to the original medical directive in that it still authorizes nurses to communicate the diagnosis of pregnancy, to collect specimens for screening, diagnosis, and management of prenatal and certain postpartum clients. It gives nurses the right to order ultrasounds for the purposes of dating, anatomy, and genetic screening, and finally to provide initial pharmaceutical interventions.
This sounds excellent. So what are the changes from the initial version we should know about?
So some of the main ones are some tweaks to the initial blood work, such as we now include ferritin and vitamin B12 levels. It's reflective of recent updates to the genetic screening practices in Ontario. There is the early diabetic screening, which is a 50 gram in high-risk clients. And also only doing urinalysis on symptomatic clients or if they're coming in with elevated blood pressures.
Wow, this sounds like a great update. How about a little bit on the laboratory testing medical directive? Can you give me a few points about it?
Absolutely. So for the last 3.5 years, we've been using the What Tests Can a Chin Do Without Consulting memo poster to draw chronic STI and prenatal labs. And we felt it was overdue to turn this into a proper medical directive.
I did have a sneak peek, an early peek at this directive. It really does go beyond that original memo. Would you like to elaborate for our listeners what's included?
So it includes coverage now for STI and BBI screening. It also includes cancer screening, so thinking FITs and PAP tests. It also includes several chronic disease screening and management labs, such as diabetes, hypertension, and anemia. It also has healthy adult and pediatric screening tests. And finally, it has chronic medication screening for certain medications, thinking mostly biologics and psych meds.
That's really great. This is really going to help nurses really get the wellness programming and screening programs off the ground. Is there anything else?
It's important to know that under each test, it has outlined the parameters, including client age, frequency of testing, and which tests are included. Also, please refer to the guidelines section to see which physician you should be putting on the requisition when sending these labs. There are documentation and client consent requirements, and who to direct your questions to. This is especially important if you have any questions surrounding the knowledge, skill, and judgment components of these medical directives.
These 2 new medical directives sound great, Liz. I really appreciate you stopping by to chat about them today. Thank you all for listening to the Practice Support Podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and iTacit, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at SLKT.Nursing.Practice.Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.